So let's begin our meeting at 5:12 on Monday, November 23rd, the Board of Health meeting. In keeping with the ongoing emergency order from Governor Charlie Baker to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by the board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda. Okay. So what we have on the meeting agenda tonight is to just have an update on where things stand with COVID-19 in Easton.
All right, and I'm going to share my screen. And minimize this and get back up to the top and go to full screen. Okay. And why is it not letting me do the full screen thing? Well, I can't get it to go to the full screen.
We can work like this.
We are technologically challenged tonight, huh?
Yeah, and Tim Myers is raising his hand. What do we do for Tim when he's raising his hand?
He might be asking that you promote him to a panelist.
Okay. How did I get this leadership position tonight? It's a little scary. I just did.
I just promoted Tim because you made me a co-host.
Oh, good, because
So usually
now
that's
we have to unmute him.
OMG.
So Tim, if you can hear us, your cameras, can you turn your camera on?
I'll try. Hold on.
Do you want me to go ahead while you guys are
Yes, please.
working out that?
Yeah, go ahead, Kristen.
Okay. So we're here tonight for our once a month COVID-19 update. And a lot has changed since the last time we spoke. The last time we spoke at the end of October, I told you that we had 384 confirmed cases of COVID-19. As of about 4 o'clock when I last ran a report, we had 536. When we last met, we were looking at the data for the 2 weeks that's in the state's report that they put out on Thursdays. And back at that point in time, it would determine whether or not we were green, yellow, or red on a risk map. They've since changed that map and have adapted the colors to just a line list type of report. At that time, a month ago, the data I provided you was that in the 2 weeks prior to that board meeting, we had 18 confirmed cases. As you can see from the slide, at this point for the previous 2 weeks, starting on Sunday, November 8th, and concluding with this past Saturday, November 21st, we have over 100 cases. We have, I believe it was 103 the last time I ran the report for that time period. And the thing that we're having a little trouble with on our end is that there does not seem to be any test results for tests that were done on Friday loaded into the system yet. Anticipating that a lot of people were seeking testing going into the weekend with plans for the coming week, I do expect that that number is going to jump up significantly before we actually get to the report data pull on Wednesday. So what I've done is represented it for you here in a line graph, and you can see it back in early October, we were down at, 8, and then we were at 4, and then we were back up at 9, and we were at 10. And then all of a sudden we made a leap right before Halloween and the week after Halloween. And now since November the 8th, we have just been skyrocketing with our test results. No surprise, the age distribution continues to be what I've shown you in previous slides. The majority of our cases are in 18 to 29-year-olds, but we're seeing a good number, in every other age range as well. We do have the holiday coming up later this week. And as we've gone over before, there is information out on the internet about how to more safely approach a holiday meal. The safest thing that's being advised right now is to just celebrate with your immediate household and not to mix households. If you do end up having a small gathering, yourself and another household, the recommendation is that it be outdoors if at all possible. If it needs to be indoors, windows should be open and people should be wearing masks. Even as odd as that seems to be in your own home, if you're not in your home with people from your household, the mask does go a long way to stop the spread of COVID. One other thing that has changed since I last gave you an update is that the governor revised the gathering limits. And just so everyone is clear, the limit for indoor gatherings now has been reduced to 10 people. For indoor gatherings at event venues and at public settings, it is 25. Outdoor gatherings at private residences and in backyards is down to 25. And outdoor gatherings at event venues is scaled depending on the risk level associated with the town. 50 if you are in a step 1 community, which is a higher risk community, and 100 if you are in a step 2 or lower risk community. What else is changing? We're carefully watching these trends. And I typed this slide saying that we're consistently seeing over 2,000 positive test results a day in Massachusetts. Today, it actually was under 2,000. It was down at just about 1,800. The key thing for that is those are results that reported today, not that were conducted today, because obviously we don't have those results. And we typically do see a little bit of a dip on a Monday because less people tend to get tested during the weekends. The Department of Public Health is carefully watching clusters. I know myself, being the person pulling the reports down and checking addresses so that we can coordinate with the schools and ensure that we are getting ample notice to families so that they don't accidentally or inadvertently send children to school because they haven't gotten their test results. I am seeing spread in families here in town. I'm seeing the same address come up positive, and then a few days later, we're seeing multiple other members of that household test positive. What we're seeing, why we're seeing that is even if people are asymptomatic, they're following the current guideline, which is to get tested a few days after being exposed. Depending on who you look at, MIT is saying 5 to 6 days after exposure. There are other models out there that say 3 to 5, say 4 to 6. So right in that range is when people, the experts do feel like there is potential for the viral load to be high enough that it would be detected in our testing and give an accurate result as to whether or not a person is possibly asymptomatic or is contagious and just hasn't developed symptoms yet. And we're seeing that in the testing that I'm seeing reported through the state. We're seeing someone in the house testing positive, the rest of the family going and getting a test, and some of them coming back. If they don't come back positive, we're seeing them test or get sick again later in another cycle. While the initial guidance has been from CDC, still stands, which is for a person to quarantine for 14 days after they're exposed. the Mass Department of Public Health has given a little bit of an option to people who may wish to consider shortening up their quarantine period. And what the state is saying now is that if all of these parameters are met, if a person has not had any symptoms of COVID, they are able to go get a PCR test. This is different than the antigen test. The PCR test is considered the gold standard. It is the one that typically, there is a rapid version of it, but we see it mostly in hospitals. It is typically the one that takes 24 to 48 hours to come back with results. If a person gets a PCR test on day 8 or later of their quarantine period, and I caution anyone listening to this that is considering taking this option to please either reach out to the office or reach out to me via email at kkennedy@easton.ma.us to confirm that we are talking about the right day in their exposure. The reason I'm saying this is the day that somebody is exposed is not considered day 1. That is considered day 0. Day 1 is the day that they are able to separate themselves from the possible source of COVID-19. So if you were with an aunt or an uncle on Sunday and they call you and say that they were tested positive, you went home on Sunday, but that's not your day 1. Your day 1 is Monday when you are actually physically separated, and you count from there. So if anybody has any doubts about where day 8 is, I don't want to take the chance of people thinking they're testing on day 7 when they should be testing on day 8. So feel free to reach out to me. I can look at someone's testing data and we can go from there. But if someone were to receive a PCR test on day 8 or later, and that test is negative, they can, after day 10, so it doesn't mean you immediately get to walk back out the door. It means after day 10, the person can exit quarantine and just continue to self-monitor and just be conscious of the fact if any symptoms do show up to take them seriously. The phrase I use with a lot of people is lower your threshold of what a symptom might be, and to not ignore the things that we might typically in a normal scenario brush off to the weather or sinuses or things like that. While we're talking about segueing into other stuff like that, I'm going to touch back again on the flu. As we're reminding everybody, flu is a respiratory illness, much like COVID. There is our ability to be able to respond to the pandemic is partly, our response is largely based on our hospital capacity. And by people taking the time to go and get a flu shot and hopefully remove potential ambulance trips, emergency room trips, even urgent care visits that could be prevented by the flu shot, lightens the load on our healthcare system and allows us to focus on those COVID patients that are most needing our attention. One new thing in Massachusetts that I've spoken about before is the fact that now, and this is not just for this year, but going forward, all Massachusetts school students who are school-age children who are enrolled in childcare, preschool, K through 12, or post-secondary colleges do need to have a flu shot for 2021. We sponsored a total of 6 clinics with CVS. 2 were for our staff and were very well received and very well attended. We then hosted 4 for residents. We were able to, with CVS help, provide vaccine to any resident who wanted it that was age 3 and up. Hopefully that will make an impact on parents' availability to satisfy this requirement. Residents who, we have been getting a few phone calls. We realized after the first clinic that CVS was not providing any type of documentation, but that kids would need the documentation for school. And we responded with a single little strip of paper that was initialed by the pharmacist who was administering the vaccine. But for those parents that attended the first clinic on October 28th, that record and that proof of getting a vaccine can be obtained from the CVS store on Depot Street. Their phone number is 508-238-0604. Just get in touch with the pharmacy. They're processing all of the insurance and all of the records, and they will be able to provide that documentation. Our ongoing prevention efforts continue. Town Hall still remains closed to the general public. We are offering in person for by appointment. We've had very little demand for these types of appointments, and upon careful review of the one that I received this week, we were able to satisfy the request by emailing and scanning the file that the individual was looking for. The executive team continues to meet at least twice a week to discuss what's going on in each of our departments, to plan for upcoming challenges, and to share information. We are going to be, adding to our topics, the distribution and how we're going to get the COVID vaccines out. So it's really nice that we have this structure where we're already talking twice a week and can add things easily into our discussions. We do continue to have daily check-ins with the school administration. These are twofold. As I mentioned earlier, we are taking all of our addresses and checking to make sure that there are or are not school-age children enrolled in the schools. If they are, they're receiving a early morning phone call, usually from me, if they're the first positive in the house, to discuss the need for everybody in the house to quarantine while the person who has tested positive is in isolation. The second check-in comes in later on in the day, where we run through questions and queries posed by all of the school nurses, and we're able to update them through the superintendent with return dates and alterations, and confirming whether or not kids are able to come back to school safely and have completed their quarantine or their isolation. That is it for me for tonight. Does anybody else have any questions?
Don't have a question, but I just want to put out there with the new regulation about being able to get tested on the 8th day or after. People should just know that it could be the case that they will not receive the test results by that 10th day. So it's not a guarantee that if you get tested on the 8th day, you're going to be able to come back on the 10th. There's kind of a delay, and I can only think that's going to get worse in test results coming back.
There's also no guarantee that it's going to come back negative.
Correct, yeah.
What we are seeing is there is a high number of asymptomatic individuals out there. And the important thing is to identify them so that we can isolate them. They don't know they're out there spreading. So by getting the testing done, because they've been exposed, they may have a higher chance of being an asymptomatic individual, but we could at least know that and have them isolate and stop the spread with them. Agreed, Lynn. We're getting test results over the weekend. I was getting test results that were from the 14th. There are some delays in the system. There are some labs that are taking almost a week to get the test results into our hands. And as I said, right now, I don't know what's going on with the system, but we had, I think, very, very few, one or two, if any, that had been loaded in from Friday the 20th.
I think you touched on what I wanted to mention was the concern is the asymptomatic positives. I've seen a few of them at work. It's that's what's concerning, because there's people that have it that don't know they have it. If you feel healthy, everyone lets their guard down a little, and you're spreading it. So the asymptomatic positives is something that, unfortunately, you need to be vigilant about, and get tested if you're living with somebody that's positive or symptomatic. It's definitely a real thing.
I agree, Chris.
So we'll continue. One of my plans is to continue to check in with the school nurses. If they start hearing that parents are having trouble getting the flu vaccine, we'll work with CVS and try to schedule another clinic. At this time, I don't plan on scheduling one unless there is some input from the community associated with need. We added one on Saturday, this past Saturday, just to make sure that we gave ample opportunity. And I believe it was attended, Tim, by 60?
Yes, 60 people.
Okay.
That seems like a decent amount, doesn't it? Or are you used to more?
I was thinking more, but if we got one, it's one more person that is not walking around without a flu vaccine. So to me, it's well worth it. Like I said, our intent was to provide an opportunity for families and parents who otherwise might find it difficult to get that vaccine for their child before the cutoff date for the schools.
Right, which is the end of this year. And honestly, we're a far way, I know, from getting all those kids vaccines in. So hopefully parents are able to get those done quickly. All right, anything else? Okay, so I know we're a little delayed because of our technical difficulty, so I'm going to make a motion to adjourn the meeting at 5:34, November 23rd.
Second.
All those in favor?
Aye. Bye.
LeBlanc, aye. All right. Thanks, guys. Thank you, Kristen. That was awesome. Well,
Happy Thanksgiving, everyone.
yep.
You
Yes.
too.
Thanksgiving.
Bye.
Bye, guys.
Bye.